Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thank you so much for tuning in. I'm glad to be here as always. It's one of my favorite things to do. And whenever I have time set aside, I can come and sit down with you guys and have this time. It's I just always look forward to it. So thank you for being here with me, and I just really do appreciate it. I wanted to talk about something that has been on the edges of this podcast, ever since I began it, and I kind of dive into it here and there. Um, it's the way that medicine is being influenced in the world right now, not just America, but the world, worldwide. Um, I don't hide the fact that I'm a naturopathic medical doctor. I'm proud of it, and that's who I am. That's what I'm intended to be when I went to school. This is what I've always driven to be. It's not something I came to later on in life. This is the definition of who I want to be as a physician. And what a naturopathic medical doctor is in Arizona, state of Arizona, where I'm a licensed physician. I am a primary care provider. I prescribe medications. I just performed minor surgery this morning. I run labs. I provide care. The philosophical underpinnings of a naturopathic medical doctor are, in my opinion, unique in the sense that when a patient presents to clinic, I'll use an example of high cholesterol because that's been something I deal with in practice a fair amount. When someone presents to clinic with a disorder like high cholesterol or high blood sugar, any of those things, I'm not the guy who's going to first just hit you with a statin. I'm not the guy that's going to first hit you with a prescription, but I will write it. I can do it. I want to do it when necessary. I want to do what's right and meet you where you are. The nature of a naturopath, I'm in the room with you. I'm not rushed. I spend the time to get understanding what's going on with you. I don't write the quick prescription to get you out the door. I take the time to build a relationship with you as a patient and deeply understand you as a person because I see myself as your doctor. And that relationship is very important to me. Every time I see my patient, it's important that every visit I work to earn trust. I don't just take it for granted. You have to earn it, which means I show accountability for why I want to do what I do. I spend the time to explain this is what I believe is happening. This is what I believe will help. This is what I believe is going to happen when we start this, and this is how I'm going to verify it. So, a patient presents to clinic, they have high cholesterol, it's oxidized. We notice we do their lipid NMR panel, and we know that there's a high particulate count. We know these are things we could be very worried about. I'm going to say, okay, well, it's not super high. It's at this level. It's a high enough risk yet, based on the standards of care that are already established. This is a good time for us to do diet. So let me say, these are the things I want you to do in your diet. I want you to eat these things. And I want you to increase these foods that are going to be high in fiber. And this is what I believe is going to work to lower that LDL. And I'm going to run labs at this point here to verify. And that to me is good medicine. Now, there's some people I need to stabilize them right away, and I will write the prescription to stabilize that person. I'm not afraid of writing an antibiotic, but I'm not a lazy doctor. I don't just write one when you walk in the door. Is it necessary? Is it the right antibiotic? Is it going to help you? That sort of thing. This is what a naturopathic medical doctor does. Why is this important? Why am I bringing this up? I believe this is the right way to practice medicine based upon my own personal life experiences. Not just because I'm successful practicing this way, because I am. I am successful practicing this way. Any physicians out there watching this, please know this works. I'm happy. Everything goes great. 45-minute visits with my patients for follow-ups, and then I'm at about an hour and a half for initials, and I'm fine. I'm happy. I'm really happy. I love work. I work with great people, so it works. But how I got to this point, my son was born in the second year of medical school for me, and it was intentional. I wanted a son. I wanted a child desperately. My wife and I, we were in love. We were happy. We wanted to have a child. My wife's job was stable, and the plan was that, between the two of us, we had a schedule that would work. where I could watch him part of the time and she would watch him and she would maintain her job. When my wife gave birth, a week after giving birth to our son, she was fired from her job, which is legal to do in Arizona. And she was not given maternity leave or anything. And we lost our health insurance. I was in my second year of medical school, and I just had, student loans. And there's a strain on us. But we thought we could figure it out. This is something that happens in life, and we'll just figure it out. When the first few weeks of my son's life, he was not thriving. You don't know pain or vulnerability until you experience that. I think that many parents who have children who've lost their children can agree and understand where I am with that. My son was born, he was not thriving, not doing well. We had no health insurance. We tried different pediatricians, the best we could get. And we really didn't get much answers other than, advising us to work on his lactation and his latch. He wasn't growing, he wasn't gaining weight. But it was just always simple, superficial things. 2 different pediatricians. Then we went to, alternative providers, because without insurance and without help, we went the other way. And we saw these alternative providers, and they spent time with us and recommended, homeopathic remedies and salts, cell salts. And I'm not going to sit here and bash either side of that at all. But I'm going to say that I was between the devil and the deep blue sea. I didn't know what to do or where to go, because the people I was seeing were not really helping. They would just look at him and say, he needs this chamomile, homeopathic, or he needs this homeopathic from, they would do their repertoire, the repertoirism, and they would do, which is a long intake of homeopaths would do. And they would say, he needs, this homeopathic remedy. I'm going to order it from Europe. And my son was dying. I kept trying. After 3 months with not really gaining weight, I tried another pediatrician that I heard of with our credit card. I had nothing. And I got a good one who's not even in practice anymore. He ran my son's labs, the first person to do that. He drew my son's blood. He himself did the venipuncture. He did the phlebotomy himself on my baby. He called me up a few hours later because he did stat. My son's potassium was not consistent with life. It was 1.8. And he's a little boy. Again, we went to the hospital, no health insurance. And he said, don't go to any other hospital other than Phoenix Children's Hospital. So we went. And by the grace of God, they stabilized him. We were put on Access, which in America is Medicare. And my son was saved. The pediatric nephrologist that stabilized my son diagnosed him and saved him because my son had a potassium wasting nephropathy, which is basically a body can't maintain potassium. It's rare, very rare. But he had it. But the doctor who stabilized him and discovered this, his nephrologist, who became his nephrologist throughout his childhood, was Dr. Mark Joseph, who went on to become, I don't think he realizes how influential the man became in my life. But Mark was an advocate for my son to make sure we got labs that insurance didn't want to cover because, again, we were getting state insurance. Mark also fought with insurance to get my son's life-saving prescriptions covered because he had to have compounded indomethacin, which is a NSAID that works with prostaglandin E2 and has an effect on potassium sparing. It played a role in my son, his health. And insurance didn't want to cover compounded medication. I want you to hear me and hear how this plays a role in how I come to you and how I've come to you in these years with this podcast. Compounded medication saved my son's life. Insurance didn't want to cover it. I didn't know what to do. If my doctor didn't fight for it, I don't know where we would be. I don't know where we would be. Insurance didn't want to cover much of his care. And Mark would consistently reach out and make sure that they were doing that. He had to fight for that constantly. I remember him telling me this. I didn't understand any of this back then. My son spent, about a month in the hospital. And I remember during that time, one of those alternative care providers came in and she said, when do we get him off of all this stuff and get him to heal? And I was just like, this is what's keeping my son alive. When my son was discharged from the hospital, he ended up having to be on a nasogastric feeding tube because he could not catch up. So for about a year of his life, he had a nasogastric feeding tube. We had to keep changing it. And I had to carry him, and I had a backpack that had a pump constantly going to feed my son. My wife didn't go back to work. She couldn't go back to work. I couldn't drop out of medical school because the student loan burden would be too great. I did not come from money. I did not have financial support. I don't have, I didn't come from anything. It was just us, my wife and I, and my son. If I dropped out of school, I would, have to start paying back all those loans. And, I didn't know how I would do that. So, I stayed in school. I don't know if I ever talk about this very much, but before naturopathic medical school, my first the degree right before that I got was as an acupuncturist. I thought that was a good prereq thing to get into naturopathic school. That was kind of a cool thing to learn prior to becoming a naturopath. And I had not been practicing. I just went from acupuncture school where I studied Chinese medicine, herbology, Taoist medicine rather, Qigong, all that stuff. I went directly from that into naturopathic medical school. I know you're probably listening to this, and if you listen to my podcast, you're like, wait, you have all that alternative stuff and you spit biochemistry the way you do? And I do. I don't see them as being exclusive from one another. I could appreciate understanding all of these things. I just want you to know I do have both sides of me. And I don't forsake my Chinese medicine background where I studied in concepts of Taoist medicine and health and the balance of health in the human body. I don't think they're exclusive of one another, but that's another podcast. So I'm this guy. I'm not even from Arizona. I just moved here to go to school. And here I am trying to start up an acupuncture practice. No background in acupuncture, no community ties, nothing. Just grit. Putting up flyers at the health food store. Those are my origins. Why is this important to you? Why is this important to the arc of the next series I'm going to do with you? Why do I want to be this vulnerable and express this to you and share this with you? I feel like I identify with you in a unique way because here you are, and you don't always have good support. You go to your regular practitioner, you're dismissed, you're not really given very good answers. You look online and you see some just pie in the sky claims and rhetoric by, influencers. At the end of the day, there's always the hook of what they want to sell you. There's always a hook. That's why I don't have a hook, guys. This is why I don't have a hook. So I'm not selling you anything. It's always someone want to make something money from you. And they're also telling you that regular doctors are awful and evil. And so you two are like between the devil and the deep blue sea. Where do you go? Who do you trust? Because on one end, you have these other doctors, your primary care providers, that are just not always listening to you. They're dismissing you. They don't spend the time with you. They don't care. You don't feel heard. And then you have other people you're not sure if they're opportunists trying to take from you. Can you trust what they're prescribing? Can you trust that they'll actually care about you? This is serious things. You have confusion with what's real and what's not real. Who do you trust? I lived that. Why I became the doctor I became today is because of that. So that none of my patients ever go through something like that. I spend that time in the room. I listen to the woman in front of me. I give her all that I have, and then some. I know that you navigate a world where you have constant hits in your feed from these influencers and people trying to pull eyes on this and that, because that's what they're made for. The feed is made for that. This is what, our social media things do is they're meant to pull you in. And then the question is, will they help you really? I made this podcast to be helpful. It's like a love letter to my younger self. That I went through something that was horrible. And then I could take it and make something good from it. That's what this is. The next series of episodes I'm going to do are going to be oriented towards how we got to this point of separation in medicine between regular medical care that you see, standard insurance-based medical care, and then you see the alternative medicine. I'm going to talk a little bit about how MAHA has made its rise, goods and bads of it, what I've seen being involved in it, in the sense of, involved in it in the sense that I'm a naturopathic medical doctor, and as a doctor specializing in this area, I am uniquely educated. I mean, there are very few care providers at the degree that I'm at in the country or in the world who are educated as an alternative care provider at the level of a physician. That's recognized by my state and also by the federal government with my prescribing. I'm one of those unique characters out there that's able to straddle both worlds of science and lifestyle, because that's how the depth of my training. So I'm uniquely qualified to speak on these things. So I'm going to speak to MAHA, how it's risen, the good and bad of it, because there are things in there we should be worried about. Specifically, as I mentioned, greed and truth and accountability. So that's what this series is going to be about. I'm going to dive deep into it. I'm going to use real examples and cases around women that I've seen. I want to be as precise as possible, use the best language that I can, because I know how important this conversation is, because it is very hard for you to know what to do. It's very hard for you to know what to do, who to trust. And I want to work hard at giving you a background of what to look for and how to discern who to trust. I hope this helps so much. I hope this helps so much. Thank you. If you like this podcast, please subscribe. And if this episode hit you well, please like it. And then if you know someone this would benefit, please share it. And I'll see you in the next episode.